Hello everybody, and thank you for watching my video. I have not done one the last day or two because I just felt like the numbers in the news was pretty much what you could get anywhere. And I didn't feel like I'd waste your time. But what I'm talking about today. So here's a photo from yesterday. I went to Disney Town. Shanghai Disneyland is still closed. This was as we were walking out. It's not a high quality photo because I took it with my cell phone. But yeah. So it was a really good day. Disney Town was rather busy, considering. Um, but we had a really good time. So there's just a couple things I want to quickly mention before we look at the numbers for today. So firstly, I created a video called Christians, What Are You Doing? If you want to find that on my YouTube channel and watch it, I'd appreciate it. I feel like we as Christians, if you're a Christian, you're watching this, we have a higher standard of expectation as to how we should be handling social media during this time. Honestly, how we should be handling social media always, but most assuredly during this time. And I highly recommend you watch it. I had recorded a different version of it, and at the end of that, Holy Spirit just told me not to use that one, to do it again. And I feel like that is the takeaway. When you think about posting something, especially something mocking, whether it's directed at other Christians or it's directed at the world in general, take a minute and ask Holy Spirit what he thinks. Because I can pretty much guarantee you the answer is no. Don't post it. It's okay to have a sense of humor. It's not okay to mock people. It's a completely different side of it. So have discernment. And we should always do that. And the world should do that. But we as Christians have a much higher standard that we have to live up to as believers and followers of Christ. Because we're his ambassadors and we're his representatives here on earth. And if we're not doing things that are representing him in the way he should be represented, we are not doing it right. So please watch the video. Christians, what are you doing? Thank you. The other thing is, in regards to studies that came out, Glenn Beck was talking about this. You can see it on his channel on Facebook. But he was talking about how, I don't remember. I'm not going to say countries because I don't remember the two countries or the two places that did the study. But they found out that even young people that have caught the COVID-19 virus and have, been healed of it, have recovered, have permanent lung damage. They can lose 20%, or is it 20% lung damage, or lose 20% capacity of their lungs, one or the other. Watch his video. But, or I might find the study and throw it in at the end if I can find it. So while we were sitting here being very lackadaisical about the fact that it really is just really detrimental to the older population, those over 60, or those with underlying conditions, it turns out that this is actually extremely detrimental to everybody that catches it. So, don't panic. I'm not saying this so people could freak out, because that's definitely not what I'm saying, guys. I'm living in China. And right now we're seeing, in Shanghai, we're seeing a very, very minute increase in cases because people are coming back to Shanghai to start working. So ours are import cases, but it's not going to take very much for it to go from an import to transmissions. And the numbers could rise quickly if we're not careful. So, as I've been saying, be smart and be safe. So this came out with this: when should people wear masks and when can we stop? So apparently there was a video about a woman, a Chinese Australian woman, who went outdoors without her mask and got into a confrontation with a person apparently about it. So the police intervened, and she was fired. Because in Beijing and in China, you have to wear your mask, right? So we get into the discussion that it's going to prevent the bodily fluid from landing on another person when you're talking, whatever. But it's not going to prevent the actual virus getting out, should that happen. But it's a measure of protection. So it says wearing masks scientifically, not only to protect each person from COVID-19, but also beneficial to public health, which is called mask civilization. So on March 18th, the CDC issued a guideline on how different groups choose and use masks. The full guidelines are as follows. So for people staying at home, you don't have to. For people staying at home and outdoors where there is no gathering and with good ventilation, no need to wear a mask. For people in densely populated places such as offices, shopping malls, restaurants, meeting rooms, workshops, or by van, in elevators, public transportation, in medium low risk areas, spare masks, disposable medical masks shall be carried, and masks shall be worn when in close contact, less than or equal to 1 meter, while wearing disposable medical masks in high risk areas. Okay, so for people with cold symptoms such as coughing and sneezing, wearing disposable masks or surgical masks, and for people who live together with those who are isolated at home or discharged from the hospital, wearing disposable medical or surgical masks. Okay, so essentially, if you're in a park and people are like so far away you can't even like hear them talking, you can hang out in that park without your mask. I'm not going to say that about China because China is different. Or if your country has mandated or required masks. This is based on the CDC. So like in America where masks aren't required, this is probably the most relevant. If you're in a park, or even if in a park and you're nearby and people are nearby, but if you're not less than 1 meter from that person, you're fine. If you want to wear, most times wearing a mask is a mental health thing. So if you feel like you want to wear it for your mental health, then go for it. In that situation. Definitely in densely populated, that's where you're most likely going to get bodily fluids on you without even realizing it's happening. Wear your mask. And then, of course, if you're sick, wear a mask. And if you're with somebody that was sick or is sick, wear a mask. So for the staff in densely populated hospitals, bus stations, railway stations, subway stations, airports, supermarkets, restaurants, public transportation, vehicles, community import, export. In medium to low risk areas, the staff shall wear disposable medical surgical masks, while in high risk, they need to wear the KN95 or N95s. This is staffs at a hospital. The N95 mask I shared in one of my videos requires that it be fit onto you. You can't just buy them. They have to be fitted because they have to have like a suction around them, and they have to be gotten rid of when they become moist. And these masks can become moist like in a half hour, depending on what's going on. And then you have to throw it away. Not the most feasible, beneficial for laymen. So when they're saying like in high risk areas, medical surgical masks or protective masks that meet the N95 or above are needed, they're mainly talking about the people working in the hospitals. Because every other place is not necessarily needed. Or even viable, because like I said, you have to pretty much they have to be fitted and you have to throw them away after they become moist. So for people in prisons, nursing homes, welfare homes, mental health and medical institutions, as well as classrooms and dormitories of building site and other densely populated places, and medium to low risk, same thing. Spare masks shall be taken with you, and then masks will be worn when people gather together or in close contact. So if you have like a staff meeting or you're all eating lunch together, which is extremely impossible to do. In high-risk areas, the work staff shall wear surgical masks or protective. Once again, nursing homes, I think the staff should definitely be wearing, because they're the ones that are going to be going in and out. I mean, family too, but they're the ones that are going to be going in and out. So I think like when they're having close dealings with the nursing home residents, they need to have those masks on no matter what. And then, of course, mental health and medical institutions, same thing. Because the mental health, the clients and the patients in these places, and the residents in these places aren't leaving. So they're not exposing themselves. The staff leave and could possibly bring in that exposure. So, for all suspected patients, confirmed patients, and asymptomatic infections of COVID-19, the close contact of the confirmed patients, all the inbound personnel from the moment of entry into quarantine should wear a surgical mask or a respirator with no exhalation valve, which means N95. All right. So I'm not going to keep going because that's going to take forever. You can look that up, the CDC standards that they set up for the masks, and just be smart and be safe. That's my motto. Just do that. So here we have China update with numbers. So we have the graphs there. So we're looking at no new cases in Hubei, with 8 new deaths, 795 recover. Shanghai has 2 new cases. As I said, like the last couple days, we've had 3 new cases each day. Today we have 2. Very minute number. We only have 34 still infected. It's a very minute number. However, when people do the math of how one person can spread it to so many different people, we just need to be wise and smart about this situation. Globally, Italy is just getting hit hard by this. So they have 4,207 new cases. They still have 28,000 plus still infected, and they have 475 new deaths. Spain has 3,591 new cases and 147 deaths. And Germany has 8 new deaths, France 89, Switzerland 14. So we're seeing a lot of numbers in there. So then Iran has 147 new deaths, South Korea has 8, and Japan has 2. Indonesia has 14 new deaths. And then the U.S., we see 10 new deaths. We're now at 118 in the U.S. Canada has 4 new deaths, and Mexico has no new deaths. Cuba has 1. The U.S. has 1,349 new cases. Brazil and Chile have a bit. Egypt has 14 new cases, no deaths, no new deaths. I'm reading just the top numbers. Let's look at the live data. I'll do that later. All right, so we have the China numbers. We already see those all the time. So here's a global. Yes, I would like to. We'll do that later. So here's the the global, and here's our numbers. We're seeing the decrease. I'd like to see a grid from the start of this, because we would see the spike with China and then the spike with, but we see China decreasing, and then we see the major spike with the world. So US is the one I always look at. That's where most of my people that watch this are. So this breaks down our numbers. New York, unspecified area. I hate when they do that. But so breakdown of cases in each area, number of deaths, number of recovered. So I guess we had 47 people on that Diamond cruise ship. And then 21 on that other cruise ship. It's just so crazy because cruises are meant to be like a good, happy, fun time. You know what I mean? It's just unfortunate. So Italy reports 475 new deaths. They're urging Italians. Medical facilities will soon be unable to help new cases, and they're urging them to stay home. At least 2,629 health workers have been infected since the onset. Right? The head of the World Health Organization said the new coronavirus was an enemy against humanity as the number of people infected in the pandemic soared past 200,000. I'm gonna say again, please stop comparing this to the flu. Please stop. We get that influenza kills a lot of people every year, that the flu is a deadly thing that happens all the time. We do have vaccines for the flu. Um, just stop comparing this to the flu, because that is so dismissive. That's why it bothers. Well, the flu kills blah blah. Like this isn't important, or this doesn't matter because the flu kills people too. So just stop that. That is so detrimental. It is not helpful at all. It's actually rather prideful, and I went off on a doctor about that and a show, but I didn't. Like I said, Holy Spirit's like, yeah, you're not gonna post that, because I was very upset because they were just so prideful and stupid. It just drove me crazy. All right, streamlining platforms. Portugal moves to declare state of emergency. Peruvian president announces nighttime curfew. We don't have that in Shanghai. We've never had that. I think the closest thing we've had is that our apartments close down at certain times. So if you don't have a way to get in, you need to be in by a certain time. But we didn't have an actual curfew in Shanghai. Traveling abroad banned citizens from traveling. Turkey will close its rail and land border. U.S. and Canada border to close to non-essential travel. Malta will stop all incoming passenger flights. Okay, so in one of the groups I'm within on WeChat, they talked about that. How somebody said that they're believing that there will be no flights anywhere in about 2 weeks. And I said, I firmly believe that, just because they're banning flights from coming and they're preventing people from leaving. So I firmly believe that at some point in the very near future, we're going to see that there are no flights anywhere. Or very limited. Extremely limited, extremely expensive, very hard to get, and you probably have to have a very good reason to take that flight. Malaysia shuts down its borders with Singapore and begins a 14-day partial lockdown. 2 U.S. Congress members test positive. British Prime Minister Boris Johnson announced that schools in England will be closed for most students starting Friday, after Scotland, Wales, and Northern Ireland announced similar measures. Taiwan authorities announced Wednesday that no one but its own residents shall be allowed to enter the region starting Thursday. They give you a little bit of time. If you need to get somewhere, you have fair warning that you need to get your butt in gear and move it. If you're not planning to go anywhere, you're fine. But if you needed to get somewhere, you need to get there. If you're still able to. General Motors and Toyota to temporarily suspend production in North America. All IKEA stores in the U.S. are closing. Okay, so here in Shanghai, our IKEA stores were closed for a while too. The New York Stock Exchange to temporarily close the trading floor makes total sense. The United States is suspending all routine immigrant and non-immigrant visa services in most countries worldwide due to the coronavirus outbreak. Australian airline Qantas and its subsidiary Jetstar will suspend scheduled international flights from late March until at least the end of May due to coronavirus. Pakistan confirmed first 2 deaths, 50-year-old and a 36-year-old. Moldova reported its first death. Mauritius, I never even heard of that, has confirmed its first 3 infections, and I'm not even going to try. First infection. So Iran reported 147 more deaths, its single biggest jump. France reported 89 new deaths in the last 24 hours. Okay, and then China's been sending stuff, so they sent some to Belgium, Philippines, and I talked about how that's remarkable there in another video. The test kits, masks, donated test kits. Coronavirus dog. A pet dog that tested weak positive several times died on Monday. The dog was released on Saturday after finally testing negative. Its owner has rejected a necropsy to ascertain the cause of death. 3 tests were conducted on the dog in February, all showing low-level infection. The animal never displayed any virus-like symptoms. I would have wanted to know why this dog died. If I was the owner, because I would have been like, my dog was healthy, my dog may have tested for this virus, but did the virus really kill my dog, or was my dog just... Because if this dog is being stuck in... Okay, first of all, we don't know the age of this dog. You're probably like, why you did? Because I love dogs, people. All right, and I don't want people to take this and start blaming animals for crap. Okay, but moving on. I'd want to know, just because I'd want to know, was my dog older? If my dog was older, then it may have just been the dog's time. If my dog was not older, did he have an underlying condition I didn't know about? And maybe that's why the coronavirus thing was actually like affecting his system in a way that it was. And the other thing is, like, was it like all the stress of him being isolated? Because dogs are pack animals, man. Being separated from his family, being poked and tested and prodded and who knows what else, and being stuck in a cage and all this stuff. And I'm not saying they were inhumane to this dog, but if a dog, okay, I have a foster dog right now. So when he first came here, he was very shut down. And now he's like showing his personality, which is why he keeps barking and all this stuff, because he's comfortable. He's been here since the end of January. It's almost the end of March. And I have not had to leave, although I'm going back to work today, but I have not had to leave my apartment like I would have had to had Chinese New Year and everything just been normal. So this dog has had interaction with, after being, somebody dumped acid on him. That's why he was a rescue. And then he of course had to go through all the vet treatments of that. And then he was in isolation until a foster home was found for him. He has an adoptive family in America, but who knows when that's going to happen now, when he's going to get sent there. So this doggo he likes me, okay? Because he's like, oh, you're a cool person, and I get food, and I get to hang out with these two crazy cats, and even when you're not here, the cats are here, except for when I take them to the vet. Those are probably the two hardest days for this little guy. But I'm thinking, okay, so what's going to happen to this poor little doggo when they take him from me to give him to his family? So essentially, he would go from me into I believe the husband's going to fly here for business, or was. I don't know how it's going to work out now. But originally, fly here for business, and he would have, and this was supposed to happen like a few days ago. And he would have been like, he would have come and he would have gotten the doggo. So he would have been taken from the home that he's known for these few months, where he's like, oh, is this my new home? Okay, like, I get that foster homes are good for doggos. I'm not against them at all. I just feel like it's like, I don't want the doggo to think I gave him up because I didn't want him. You know what I mean? I care about doggos. I care about children too. Don't start getting all crazy. Anyway, point being, I would want to know why the dog died. But I'm going to tell you right now, don't start blaming animals for this crap. If they do trace it back to having come from some exotic animal or some animal at that wet market, then we can address that concern when we get there. But they've already proven that it can't be transmitted through the pets. There's no at this point there is no evidence that a dog can give you coronavirus. So, well, just get there. I feel like that story really needs more information. Germany is facing its biggest challenge since the Second World War in the fight against the coronavirus pandemic. Situation is serious. Take it seriously. Not since German reunification, no, not since the Second World War has our country faced a challenge that depends so much on our collective solidarity. Germany expanded entry restrictions. Oil prices had another jaw-dropping skid Wednesday, sending the price of U.S. crude oil below $21 a barrel for the first time since 2002. Benchmark U.S. oil lost $6.58 or 24.4% to settle at $20.37 a barrel. $20.37 a barrel. Brent, the international standard, dropped $2.85 or 13.4% to close at $24.88. All right, guys, so all I can say is what I've always been saying. Be smart and be safe. Don't give in to panic. Don't hoard and don't panic buy. Be there for your community. Be there for each other. And don't spread fake news.
Hello, everybody. I just want to take a second. So I was able today to go into Starbucks. I was able to do that yesterday at Disneytown as well. But I was able to go into my Starbucks. And I call it my Starbucks because it's the one I actually spend the most time in. It's the one near my center. And there's a few of the employees that are just so amazing. And pretty much at any Starbucks I go, I always meet these exceptional people. I feel like the Starbucks here in China are just above and beyond. And I've always really liked Starbucks in America as well. Um, but you meet such caring people that work in this Starbucks. And I think we take them for granted. But so there's a young woman there. Her name is Jupiter, and she's always so happy, and she always does the sweetest things when I order my coffee. She's the one that would give me the gingerbread latte when they were out of the syrup. I think they just found a syrup, and they're like, oh, she likes the gingerbread, so they'd give it to me. So when I saw her today, she said, hello, because I was standing there waiting for my order to take it to go. And I was like, oh, hello, how are you? And she's like, I am fine. And then she told me that she held up a cup and she pointed to the cup. And I want to show you what's on the cup. So she showed me that the cup, and the other cup also had a message on it. She didn't show it to me, but she showed me the first one, and then the other one also had a message written on it. And so I told her, oh, I've missed you all so much. And she's like, what? And I said, I've missed you. And she said, oh, I miss you too. And I just have to say, like, one of the biggest things that has really helped me adjust to my culture shock here, to days when I just felt like giving up and going home, those really lonely, hard days, was just going into the Starbucks that I felt familiar and I felt recognized, and I felt like they never harassed me to leave. I could sit there for hours. And even though the bathroom is a bit far away, I could even leave my stuff and walk out and come back. I mean, I'm very much aware of who's in there before I do that, but I just feel like it's such a safe place. And so now I think that's going to be one of the biggest things I'm going to appreciate once we can start going back to normal. So they're starting to let people sit in there. It's with the masks on. But I'm very excited now this next week to take advantage of that. So I'm really looking forward to it. But I wanted to share that at the end of this video because I felt like it was such a refreshing thing to be back in the Starbucks, to be greeted with that wonderful greeting, and just to start to feel like my self-care could actually begin again. And I think one of the most things, guys, just don't let go of your self-care. As you're facing social separation or social distancing, you're facing any kind of isolation or quarantine, find a way to get some form of self-care. That's why I started teaching myself piano. That's why I started building these random Lego buildings. All of this stuff was to try to give myself some form of self-care, because I had the more intense version of quarantining, self-quarantining, social distancing, and all of that, and isolation, based on the fact that like nothing was really happening around where I lived, and I didn't have anyone to spend time with, no roommates and no one around my area, and then of course everything just being kind of shut down. So while I didn't experience the quarantine that a lot of people are really facing, intense quarantine, I definitely didn't get to feel a milder version of it either, because I was highly isolated for most of this. So just try to keep your self-care and your mental health in a really good place. And try to see the joy in the little things. All right. And once again, as I always say, be smart and be safe.